I always like to tell the viewers so they can get a mental image of the vast amount of the size of your endothelium. And this will be the fun fact of the day. If you tie the endothelium end to end, it goes around the planet 2.5 times. I mean, this is how much of this you have, right? And nitric oxide is the main regulator of that entire system.
That's right. You know, every organ, tissue, and cell in the body is controlled by access to oxygen and nutrients through the cardiovascular system. So if your cardiovascular system isn't healthy and you don't have sufficient nitric oxide production, then you're depriving those organs, tissues, and cells of oxygen and nutrients, and they basically become dysfunctional. If you don't give the body what it needs, it can't perform. You know, in the 1980s, it was discovered that the endothelial cells make a substance called, at the time was called endothelium-derived relaxing factor, or EDRF. And so it was that molecule that controlled the tone of the blood vessels. So whether it's, you got really healthy blood vessels that are compliant and soft with each heartbeat, or without this molecule, your blood vessels become stiff. And there's a lot of damage that's caused with these pulse waves from each heartbeat. And then when that was discovered to be nitric oxide, then that kind of opened up the field. So what does this mean? That if your blood cells, if your endothelial cells can make sufficient nitric oxide to maintain vascular tone and elasticity, then it protects the blood vessels from atherosclerosis, or the fat and deposition and the instability of the blood vessels that you see in patients with cardiovascular disease.